Afternoon. I'm State Representative Seth Grove, and I'd like to thank you all for attending this press event. On December 11, 2019, the House Government Oversight Committee released a staff report entitled Medicaid, Provider Fraud and Improper Payments. The report highlighted several key areas of risk we must address, not only with Medicaid, but across state government. Based on this report, we're here to announce the release of several bipartisan and bicameral policies to address provider fraud and improper payments within the Commonwealth. Improper payments can be fraud, waste, and abuse, but it also covers payments which have been made to deceased individuals, to entities which have not provided proper documentation, an overpayment, or an underpayment. Since the 1990s, the federal government has been tracking federal improper payments, including some payments states make on behalf of the federal government. For instance, in the 2017 Payment Error Rate Measurement, or PERM audit CMS requires, Pennsylvania made an estimated $642 million in improper payments. A 2018-2019 quarterly U.S. Labor and Industry report on unemployment compensation payments showed Pennsylvania made $140 million in overpayments and $2 million in underpayments. The most egregious is the $43 million managed care organizations paid out in preventable provider conditions, such things as cutting off the wrong leg, which, by the way, was discovered by a U.S. oversight or U.S. OIG audit. Recently, Florida was hit with a $412 million federal disallowance for federal payments from one hospital, Jackson Memorial Hospital in Miami. Federal law requires improper payment rates cannot exceed 3%, and states will owe anything above the 3%, which means Pennsylvania is currently at risk for millions owed to the federal government. Making payments the first time saves both time and money, and most importantly, improves public trust in their government. Provider fraud, which Attorney General Josh Shapiro will go into more detail, is high cost, big time fraud and millions of dollars. His grand jury report pointed out some common sense solutions to addressing fraud before it begins. On top of this, Pennsylvania does not have a False Claims Act, which was first created by President Abraham Lincoln to reduce fraud within the military during the Civil War. The False Claims Act has been an effective deterrent in fighting fraud by the federal government, has been effectively used by numerous states from conservative Texas to liberal Hawaii. Fighting fraud and improper payments isn't a Democrat or a Republican issue. It is a good government issue which citizens expect of their government. Combined, this package of bills fights fraud and improper payments by giving agencies the tools to stop it in the front end and provide prosecutors the tools to hold those who perpetrate theft against the taxpayers to justice. By the way, some of these policies did start from executive orders by President Barack Obama and championed into law by Republican senators and congressmen. I'd like to first introduce my former House colleague, Attorney General Josh Shapiro. And General, thank you for you and your very competent fraud-fighting staff and their assistance thus far.
Thank you.
Thanks, bud.
Well, good morning, everyone. Let me begin by thanking Chairman Grove for his leadership. And let me also acknowledge that I agree this is a good government issue, as evidenced by your reference of both President Lincoln and President Obama. This is a nonpartisan issue that brings people together to solve a challenge. And I want to thank you, Chairman Grove, for your leadership. I know we have many elected leaders behind us, but let me also single out Senator Williams, who will be speaking shortly, for your leadership in the Senate, as well as Chairman Bradford and others who are here who have done tremendous work. I want to thank my Chief Deputy Attorney General, Laurie Malone, my Senior Deputy Attorney General, Jason Karasik, and let me also thank our Government Affairs Liaison, Adrian Muller, for their tremendous work, which allowed us to reach this day. Today in 2020, we literally have no way of quantifying how much money is lost to Medicaid fraud here in the Commonwealth. Nationally, the federal government estimates that fraud and improper payments account for up to 10% of all Medicaid expenditures. In Pennsylvania, we spend $31 billion on our Medicaid program every year. That means that it is possible, indeed it is likely, that $3 billion of our Medicaid payments are lost to fraud and improper billing each and every year. $3 billion. Glaring legal and legislative loopholes create a breeding ground for bad actors in the Commonwealth who are able to exploit a system that requires more resources and person power to properly detect and root out fraud. And as we confront the challenges with the current methods to address fraud, understand who's paying the price in Pennsylvania. It's the Pennsylvania taxpayers who are paying that price. Throughout our work in the Office of Attorney General, we see more often than not that those who primarily manipulate the system are companies and corporations peddling in bad faith. They see low-income, vulnerable Pennsylvanians turning to our state Medicaid program for critical care as really just an opportunity to illegally profit. And unfortunately, we have no shortage of these scammers here in Pennsylvania, and our current laws are not set up to deal with this. Back in April of 2019, as Chairman Grove spoke about earlier, I announced key recommendations set forth by the 42nd statewide grand jury. The grand jury's efforts found just how far-reaching and widespread this fraud was, and they recommended specific changes to combat it. Their recommendations were pretty simple. First, require a state provider number to see who is actually providing services to patients. Second, include the date and time specificity for all payments and claims. And third, require standardized state training for anyone providing services utilizing a state provider number. Simple but impactful reforms recommended by these grand jurors. Very common sense. Now, in addition to providing recommendations, the grand jury's investigation also helped us identify key areas to strengthen my agency's authority to combat fraud. If our agency can't prosecute fraud criminally, then we need to open up an avenue to hold them accountable civilly. This bipartisan group of legislators standing before you, they recognize that fact, and thus they have sponsored the Pennsylvania False Claims Act. This provides critical, overdue civil jurisdiction for the Office of Attorney General to combat fraud. Pennsylvania's lack of a False Claims Act has had a significant and negative ramification on the taxpayers of Pennsylvania. For a state that houses almost 13 million people and spends $31 billion on Medicaid expenditures, our state recovery efforts are lacking. And look, boiling this down, here's how it basically works. There are two ways to go after these fraudsters: criminally, as I said before, and civilly. And while our office has a robust Medicaid fraud division and is able to prosecute and recover limited restitution, without a False Claims Act, we have no mechanism in Pennsylvania to address fraud civilly. And without that ability to go after these companies civilly and hit them where it hurts the most, in their pocketbooks, Pennsylvania is forced to leave literally billions of dollars on the table in recouped money for fraud. And it shows. Look at what's happened in other states. And Chairman Grove referenced some of the other states that have a False Claims Act. In Massachusetts, with essentially half as many people as we have in Pennsylvania, they recovered over $21 million for their residents last year. In Florida, a state that spends almost $10 billion less on Medicaid than we do in Pennsylvania, they recovered $6 million last year. And get this, for the top 8 spending states on Medicaid, Pennsylvania is the only one of those 8 states without a False Claims Act. That means we collect a whopping $0 for the Commonwealth of Pennsylvania. That means the taxpayers of Pennsylvania have to shoulder the burden for the conduct of these fraudsters. And that means less money going to treatment, less money going to prenatal care, less money going to nursing homes to care for the elderly, and that's less money going toward expanding this program to help more Pennsylvanians. Combined, these bills, the 3 grand jury recommendations and the False Claims Act, allow us to prevent fraud when fraud happens and gives us the ability to recover for Pennsylvanians should it occur. Look, one of the reasons why you hear me talk about how much I love this job and the opportunity to work with these colleagues is that we see challenges in our communities and we have a unique opportunity to work together to address them. So much of our time and in our systems today are met with people, seeing a news story and feeling helpless to be able to do something about it. Here in Pennsylvania, we see a problem, we amass a bipartisan group of big brains to deal with it, and now we've got a specific solution to go out and deal with it. And the winners in this are going to be the taxpayers of Pennsylvania. The winners in this are going to be people who strive to put forth solutions that benefit the Commonwealth day in and day out. And the people we're going to hold accountable are the ones who are defrauding the good people of Pennsylvania day in and day out. This gives us added tools to be able to do that, and I'm grateful to the lawmakers who are here, who are taking a leadership role on this. I'm grateful for what I have to believe are going to be big bipartisan majorities in the House and the Senate to deal with this. And while I am mindful that there will be powerful forces and some lobbyists who try to stop this, understand this is a good common sense idea with bipartisan support that deserves the attention of both chambers and deserves to make it to the governor's desk as soon as possible. The taxpayers of Pennsylvania want to see this happen. The Attorney General wants to see this happen. And this group of capable lawmakers want to see it happen, and I believe it will. And with that, I'll turn the podium back over to our leader, Chairman Grove. Thank you.
Thank you, Jim. I'd like to introduce Senator Lindsey Williams, who will be prime sponsoring a State False Claims Act in the Senate, and I'm glad to have her taking a leadership role in the passage of this important legislation, as she has a consumer and experience working with whistleblowers to fight fraud, waste, and abuse. Senator, thank you so much.
Thank you very much. Thank you. As a whistleblower myself, an attorney who has worked with whistleblowers for years, I can tell you that people, they want to do the right thing. They want to report fraud when they see it, but there is a lot of risk in doing so. They may lose their job, their pension, and their health care all in one fell swoop. According to the Association of Certified Fraud Examiners' 2018 Global Study of Fraud, 40% of fraud is initially detected by a tip, and 2% of fraud is initially detected by law enforcement. I knew that number before I even looked it up because when I was working at the National Whistleblower Center in 2008, the statistic was 46.2% of fraud was initially detected by a tip and 3.2% was detected by law enforcement. I have repeated that statistic a lot over the years. The association conducts this global fraud study every 2 years, and the numbers are about the same every time. That means that even if Attorney General Shapiro or Auditor General DePasquale do a fantastic job, they'll only find about 2 to 3% of the fraud. That's simply not good enough for Pennsylvania. Pennsylvania's taxpayers deserve to have their money spent in a responsible and accountable way, and we can't say that's true right now. We have to do more to encourage people to tip off law enforcement to state tax fraud. And we know how to do it. It's the False Claims Act. In 2018 alone, the federal government recovered $2.8 billion under the Federal False Claims Act. 31 states have seen the value in passing their own State False Claims Act. The federal government and many states have recognized that protecting and encouraging people to report fraud is the absolute best way to both detect fraud and deter future fraud. The anti-retaliation provisions in the False Claims Act are the protections that make it less likely that a person will lose everything when they speak up to protect our taxpayer dollars. Right now, if you were to walk into an attorney's office and ask about how to report abuse of state taxpayer dollars, the attorney would tell you the mechanics, but then they would also tell you that there is little to nothing to protect you from getting fired for reporting that abuse. Most people cannot afford to take that risk. We don't want people to walk out of that office and stay silent. I want to protect them so that they can protect us. Protecting taxpayer dollars is not a Republican or Democrat issue, as we heard earlier. I had the pleasure to work with U.S. Senator Chuck Grassley on federal legislation to extend the False Claims Act to securities and commodities fraud. I'm proud now to be working with Chairman Grove as the prime sponsor of the Commonwealth Fraud Prevention Act in the Senate. The Senate bill has 16 co-sponsors so far, including Democrats and Republicans, including Senator Kristen Phillips Hill, who's here today. Pennsylvania has lost billions of dollars to fraud, and we simply cannot afford to wait any longer to pass this legislation. Thank you.
Thank you so much, Senator, for your leadership. I'd also like to take a moment and thank my cohort in oversight, Chairman Matt Bradford. He does a really good job because he's both Appropriations Chairman and Oversight Chairman, so he's very busy. Thank you so much for you and your staff for all your work. And also Joe Torricella, our State Treasurer, for his input and work, and also Governor Tom Wolf's office. I really appreciate their input in the legislation, working with us to move it forward. With that, I'd like to introduce the to date, the House Republican, or the House co-sponsors of legislation, starting with Representative Wendy Thomas.
Thank you, and thank you to our Attorney General for his leadership on this issue. As he's outlined, it's our responsibility to fix this system so that people who are eligible for Medicare benefits can get the most from what they receive. When the grand jury report making recommendations for improvement in our systems, it's important for all of us as legislators to look at these ideas and then move them forward to fix our system. We all want to help those who are in need. Therefore, I am sponsoring legislation to increase the penalties for those who knowingly cause a fraudulent Medicaid payment. If it amounts to over $100,000 of taxpayer dollars, it will become a second-degree felony. When this money goes out to those who seek to steal from the system, it impedes our ability to help those in need. And when the penalties are not strong enough, we cannot stop fraud. When you plot to steal thousands from the Medicaid system, you should pay a harsh price. Thank you.
Thank you, Representative Thomas. Next, we have Representative Valerie Gatos, who will be introducing the first ever improper payments state legislation.
No, well, thank you. This is all part of the package, and so I'm pleased to be sponsoring this bill. So thank you.
That was amazing, amazing. Thank you, thank you. She's a true public servant. Next is Representative Clint Owlett, who is authoring legislation to work with U.S. Treasury on the Do Not Call program.
I don't know if I'll go quite that quick, but Sankey has a Chick-fil-A coming up, so he asked me to go quickly. Thank you for the opportunity to be here today as we work together to make sure that we manage and create good government here in the Commonwealth of Pennsylvania. There's a fine line between the government's responsibility to provide a safety net for individuals and families who have fallen on hard times, and a responsibility to the taxpayers who foot the bill for that safety net. It's incredibly unfortunate that we need to find ways to stop bad actors who are trying to game the system and thus taking resources away from the people that really need them, and basically stealing from the people who work hard and earn money to send down here that we would invest in our community, back into the communities. It's our responsibility to find ways to fix this broken system and responsibly use the money that the good folks of the Commonwealth of Pennsylvania have entrusted to us. I'm excited about this package of reform bills because it will help us better live up to the commitments and the responsibilities as legislators. My bill calls for the State Treasury and the government's budget office to establish a Commonwealth Do Not Pay initiative modeled after the one created at the federal level. This system is designed to identify, detect, and prevent improper payments before they happen, exactly what we need to be doing in the state of Pennsylvania. The Do Not Pay system is designed to streamline the process by referencing a variety of data sources to determine who may be ineligible to receive taxpayer funds. Stopping improper payments before they happen has the potential to save, that's right, save the Commonwealth money, millions and millions of dollars not only by avoiding payments to ineligible people, but also by avoiding the costs and the stress associated with trying to recover those funds that were improperly paid out. That means more money will be available to help people who truly are in need and to fund the core functions of our government that the taxpayers have expected us to deliver. I want to thank my colleagues and the General for this package and being able to be a part of it. I look forward to seeing these move through the House and the Senate and signed into law. Thank you.
Last but definitely not least is Representative Tommy Sankey on provider preventable conditions.
Talk for an hour. I got to slide this down. I'm shorter than these guys. You know, we have a package of bills in front of us supported by a bipartisan group of legislators, supported by the Attorney General, that's going to give him the tools to prosecute the waste, fraud, and abuse in the Medicaid system. I'm proud to be a part of these bills, and I think that as we move forward, we can move these through fast and show the taxpayers that we are pushing good government. Taxpayer resources are finite, and when it comes to Medicaid dollars, we must ensure those resources are used efficiently and effectively. A recent U.S. Inspector General report showed that DHS paid $49 million in taxpayer funds for provider preventable conditions, PPCs. So federal law prohibits provider preventable conditions from Medicaid reimbursement. So we're trying to attack this in the simplest terms to give those tools, to give those necessary measures that we can do to attack the $49 million in waste just on this bill. So PPCs are typically surgical procedures that are done on the wrong person or even possibly the wrong body part. So taxpayers should not and legally are not responsible to pay for wrongfully performed surgery. In order to prevent PPCs, our proposal would require would require service providers under Medicaid to enter into a contract with DHS and allow the Commonwealth to recoup money wrongly spent on a PPC. Failure to do so would result in a fine, which would be up to 5% of the total amount of PPC paid to the provider. Any provider under Medicaid failing to keep proper documentation ensure that has not been a provider preventable condition would face fines ranging anywhere from 0.5% to 5% of their total Medicaid claims. So we're talking about some serious money now. While these provisions are punitive in nature, they will serve to deter providers for billing unnecessary Medicaid for egregious mistakes such as operating on the wrong person. So I look forward to being part of this group of bills, and I thank everybody for their part.
It is long. Thank you all so much. I'd like to thank the prime sponsors, General Shapiro, Governor Tom Wolf, Majority Leader Brian Cutler, and Treasurer Joe Torsella for their work in support of this package of legislation. Fraud is unwelcome and not tolerated in Pennsylvania, and that's basically what we're here to say. With that, any questions?
On protections for whistleblowers, could you just touch on, what protections, if any, are in place now and what would be under this legislation?
I mean, we have whistleblower laws already effective in Pennsylvania. Off the top of my head, I can't spell it out specifically. We had to go through training on oversight in case whistleblowers do come forward. They're protected. We have to protect them as a General Assembly. Same thing as they interact. So there's a lot of protections with whistleblowers currently in statute.
This is stronger and more clear and has really laid out anti-retaliation provisions.
Okay, thank you.
Any other questions? None? Thank you all so much. Appreciate it. Thank you.
Chick-fil-A.